yourselves and tell us where we are.
Hi, so I'm Peter Sainsbury and I'm pretty much retired now, but I'm a public health doctor with a strong interest in equity and climate change. And this week there's a meeting of researchers who are working on a Centre for Research Excellence funded by the NHMRC, which is looking at the social determinants of health and equity in health. And this is reviewing the research findings to date.
Fantastic. Can you tell us about the single most important health equity issue you would like to highlight?
Well, that's really interesting, isn't it? Because if you're talking about equity, it's not about a single issue in some ways. It's people who are at the bottom of the pile suffer in so many ways. They've got no money, they've got no voice, they've got no housing. And I'll come back to this in a moment, but they're most exposed to things like climate change. And so it is a wholeness. It isn't just one issue. But if I was to focus on one issue at the moment, then I'd say climate change, because climate change isn't just an environmental issue, it's a human issue, it's a human health issue, and we know that the people who are going to suffer the most as a result of climate change in Australia are our people who are poorest and most disadvantaged, and around the world it's the communities and nations that are the poorest and are suffering the most now. And so that's the issue I'd like to highlight.
So what's your advice to policymakers on that? I mean, do we address climate change or do we address poverty?
Well, the two go hand in hand, and the Paris Agreement accepts that you can't attack climate change and limit the damage that climate change will do without also addressing social inequalities and the Sustainable Development Goals. We must do them all, and what we know is that our Australian politicians are failing abysmally in this regard. They are just completely ignoring the future, and it's disgraceful, and that has to change. And quite frankly, I can't see it changing unless there's a change of federal government next year.
Thank you very much. Now, could you please introduce yourself?
Sure, I'm Jeff Collin, and I'm a Professor of Global Health Policy at the University of Edinburgh.
And what's the health equity issue on your mind this week?
I guess one of the things that's been really exciting about this conference is the breadth of the issues that's been addressed. And as Peter says, too often we look at health issues in splendid isolation from the broader context. And the real exciting thing about this project is the extent to which this is driven by engaging with that broader context. But I guess just to build on Peter's comments, I'd probably flip it slightly and think about, what areas have Australia and other countries been successful in, and what lessons can we learn from that? Now, my background is in working on tobacco control, and Australia, of course, is a world leader on tobacco control. And if we think about how the remarkable strides have been made in that field, it's been through recognising that tobacco isn't an issue of individual choice. It's a behaviour driven by the activities of a particular set of corporate actors whose profits are reliant on increasing harm. And so Australia, in common with the WHO Framework Convention on Tobacco Control and many other countries, have sought to regulate those industries. Now, given the scale of health inequalities driven by non-communicable diseases, and given the extent to which non-communicable diseases more broadly are driven by the behaviours of not just tobacco companies, but alcohol companies and ultra-processed food and drinks companies, wouldn't it be great if we could think about maybe extending the lessons that we've learned from tobacco control into these other fields?
What about in relation to Peter's comments around climate change?
Climate change is clearly climate change trumps everything, but these don't need to be pursued in splendid isolation. And there's a lot of synergies between the approaches that I'm suggesting in the context of NCDs and what's necessary to tackle climate change seriously. A prerequisite for thinking about getting serious on climate change is recognising and tackling corporate interests which are incompatible with those health goals in very similar ways to what I'm referring to in the context of NCDs. And we need to question lots of the kind of assumptions that underpin our approaches to health policy at the moment if we're going to get serious about tackling these issues.
Brilliant. Thank you very much. Now, everyone can follow this discussion on Twitter using the hashtag SDOHfuture. And that's continuing today and also tomorrow in Canberra. So we'll just say thank you very much.